Good morning, everyone. This is another update on Amethyst. It is Wednesday, the 22nd. Yesterday, we went to see the cardiologist, and so this is what we found. First, this is a picture of a normal heart, and I added this little thing here. This is called the ductus arteriosus, and it is a thing that babies have before they're born, and it carries blood from this, which goes to the lungs, into the aorta, which goes to the lower body. And the reason that they have that is because babies aren't getting their oxygenated blood from the lungs, so it's kind of like a bypass. They're getting it from their placenta instead. So the cardiologist told us that yes, she does have a hole in the bottom part of her heart. I'm just going to draw this in. I wanted to show you both pictures, and I didn't want to print both of them, so I'm just going to color this in. All right, so this right here is sort of to represent the hole that she has in her heart. I don't actually know how big it is, but they said it was pretty significant, so I made it kind of big. That is one problem that she has at birth or shortly after birth. They'll have to patch that up, and that's something that they can do depending on the size of the baby and when it needs to be done. So then this, red and blue, they thought was reversed. It's not reversed, so that's good news. However, she has just as bad of a heart defect, and I'm going to show you what that is. Hopefully this is clear. Okay, so up here, where it should just follow and go around, there's no connection between this side and this side. So the only way that blood is getting to the lower part of Amethyst's body right now is through the ductus arteriosus, this little thing. But after birth, that's expected to close for normal babies. That's what happens. So if she were born and did not have corrective surgery or some protective measures taken, then she would die because she's not getting the full circulation of her blood. I'm trying not to cry because this is a pretty big deal. The doctor told us that because of her growth restriction, she's going to be super tiny when she's born. We don't know when she'll be born because it depends on how she is handling being inside of me. And so if I hate the words that he used, and I know he was trying to be kind in telling us all the details, but it really wasn't kind. He told us that if her growth restriction was bad enough that she needed to be born this week, they would probably do nothing to save her because she'd be too tiny for them to do anything. Okay, I'm trying to make this video short because I don't want it to be another 20-minute video for you guys to try to watch. So obviously we need her to stay inside as long as possible, but safely. So we're going to continue to be monitored every week. And the recommendation is that we're going to go to Ann Arbor for delivery, which will happen probably around 37 weeks, if not sooner, because the risk of stillbirth goes up after 37 weeks for both intrauterine growth restriction and for these heart defects. So there's another piece to this puzzle. Down here, where this hole is, there's a little flap of tissue that as she grows, that flap is going to grow as well because it's supposed to grow across, right? But it's not connected. So if that continues to grow, it'll slowly come, I'm going the wrong direction, over this flap, which is bringing oxygenated blood to her upper body. And if that closes, then this part of her heart gets smaller, or rather it's just not growing proportionally because there's not enough blood flow to this part of her heart. So then it also will cover part of this or all of it, depending on how things are growing and how quickly that happens. So then that makes the aorta, this part, this tube, smaller, which means that there'd be less blood flow to the top of her body, because these up here go to her head and her arms and all of her upper body. So that's another thing that they're going to be watching for. I have to go to Ann Arbor to see some specialists. We're going to talk to a surgeon and cardiologist and the people who will be in charge of like delivering her and her special team when she's born, so that they can tell me like what's the plan. And we're going to see them in 2 to 3 weeks, depending on how the growth restriction is going. It's just a lot, so I'm not going to talk about the heart thing anymore. At some point, I'm going to Ann Arbor, and I'll be delivering there. That's basically what you need to know about that. In the meantime, I'm seeing the maternal fetal medicine people here, and they'll be monitoring her growth. There was one piece of potentially good news. I talked to you guys about the number that her heart rate, her blood flow from her umbilical cord needed to be is between 0 and 3. And hers on last Wednesday was 8.1 and higher, and stopping in between beats of her heart. On Friday, it was 5.6. When I saw the cardiologist yesterday, I don't know if their scale is the same. I'm hoping it is, because it'd be really good if it was. I'll find out later if it is. But he said it was 0.8. So if that's true and it's the same scale, then she's getting really good blood flow, and maybe she'll catch up in growth at least a little bit. That's my hope, but that's not something that anybody there has said, because they haven't communicated with me how things are going. But I will be getting more information on Friday when I go in to see them at about 3:30, 3:45. So keep praying, please, and I appreciate your prayers, and I feel like they're working. I believe that if she didn't have growth restriction, we wouldn't know about this heart defect. And so, in God's grand plan of things, maybe he gave her a growth restriction for a short period of time, and it's going to go away, and she's going to catch up with growth, and she's going to be all right, because now we know that there's a heart defect, and we know what it is, and we know how it's treated. So yeah, that's where we're at. Thanks, guys, for all your prayers. I really appreciate it.